A press briefing was held today, the 7th of July 2021, where the Minister in charge of Health Department, Prestun Tinsong, had informed the media of various discussions and advisories issued by the government with regards to curbing the infection rate of the COVID-19 virus in the entire state of Meghalaya. He also informed that till date, the infection rate in the entire state stands above 10%. In the presence of the Director of Health Services, Dr. Amanwar, and the Commissioner Secretary of Health, Sampat Kumar, the Deputy Chief Minister of Meghalaya, also in charge of Health Department, Prestun Tinsong, stated that the only way to curb the infection of the virus is through vaccination. He therefore urged upon all eligible individuals to get themselves vaccinated so as to prevent further spread of the Delta variant of the virus, which he says has an infection ratio of about 1:6.
My principal secretary will add more. Let me just inform you. The second wave that was started in this year, sometimes in the month of April 2021, the medical experts has fully proved that all the cases starting from April 2021 is a Delta variant. It is a Delta variant. And this Delta variant, the difference between the first wave of 2020 is this. If one positive case happens during the first wave, it multiplied only 3. Means if I get positive, I may be immediately infected to my primary contact, 3 people. But the Delta variant or the second wave which we face now, it is double than that. 1:6. The infection takes place 1:6. If 6 positive cases again, if you multiply, it comes to about 36, which is very, very dangerous. The only tool right now that we have in hand is go for vaccination.
While referring to the government's extension of financial help to the COVID-19 positive patients, Prestun Tinsong stated that the government has decided to cut down the out-of-pocket expenses of patients by putting a ceiling on the daily expenses per patient according to the 5 categories of treatment in both private and mission hospitals across the state of Meghalaya.
Hakajing sumar ya kini kibatang COVID-19, but hadir mengi'i ubabun bah haki private hospital. Kibalek se kabil jonggi, but katu ka MHIS kabingi ai mangi. Kamlah ban cover teng batang si tengu. Lada kadai la se sispa tengka tekdeng MHIS kajos tamkum handru po tengka. Nang ta sau ho tengka pada kapsil na ketlala jam. Te nakata kadau nakaliang ke sarkar lengba jangka MHIS nila sim ya karai minta ke jarwi. Bangin penhe ia kini kador kabingung ka seling. Kador ka seling ka ba ngila kenya pa kata kalti manung maksimum. Te ya kini kador ngakwa panitu ngibu haki santeli ki kategori. Kabanun kau, itu kibarung haki hospital, but kibong dan kam ya kanika oksigen. Kam kador kabakini ki hospital kim day ban chat palat kajinglut nakan nyaw hajar sisi. Kabaan itu kijenal won iba don kam ya oksigen. Kador kam day ban palat ya kakhanwi hajar Sunspark sisi, kebalai, kita kebetulan kam ke ICU tambah light no ke ventilator, hatsau hajar tingkah sisi, nata kawipat ke ICU, bat ke bomdon kam ya ke invasive ventilator, hat pra hajar sisi, bat ke bas khaddu ICU but ventilator hadu artho hajar tengka siswi. Ya kane kador ngin pentreka nadu ka khatsan kare ugnai apa artho ibat nilai kenji ba hakane ka calculation kan isip nilati kena bakatu ka out of pocket expenses kan meet yang itu dibalik sumar hapo di hospital.